practices have something happening this year that they want to focus on. Okay, so it might be that you're launching or relaunching or rebranding your practice. Might be that you've got a big birthday. So there was a practice in Melbourne that went, oh, we're 20 years this year. And I'm like, what? Do you think that might be something you want to talk about? Because, hey, your corporate's not going to be 20 years this year in your suburb. She's like, oh, yeah. You know, for us as a business, we're 10. We're turning 10 this year, so we need to make the most of it. You know, is there something in your practice? Have you got a big birthday? You know, or are you bringing in new services this year? Again, in Melbourne, one of the practices was really focusing on injectables. That was her focus for the year. Are you bringing in new staff, new services, okay, new equipment? You know, have a think. Is there anything that springs to mind that you're going, crikey, you know, that's what we really need to focus on, that's what we need to talk about? Nothing that you can think of? If you are like me, who are in fact probably like Mel as well, book junkies, these are really good books. Has anybody read any of the Vern Harnish books? He talks about the one thing, you know, and if you can have the one thing for next year, what is your one thing that you want to focus on for 2019? You know, and you can theme the year, you know, this is what we're going to focus next year. This is it. You know, you tell your team, you tell your patients. It's a great way to start the year, and it's a great way to focus the efforts for your year. So have a think about what that one thing could be for your practice next year, your major focus. So we've talked about what your revenue was for this year. Where do you want to be next year? Okay, you're hopefully going to go back and look at your active patient numbers. Where do you want to be? Okay, new patients per month and what your marketing budget should be. So one of the questions that I'm often asked is, well, I don't actually know how much I should spend on my marketing. What should my budget be? I've got no idea. And it's completely aligned with how fast you want to grow your business. So there's 3 different levels of practice growth: rapid, sustained, and retention. So we've established that there's no new practices here. Is anybody hemorrhage clients or bringing in new associates where they really need to fill books? Is there anybody? Nobody? Yep. Okay, so you're in rapid growth. Okay. Sustained growth, and this is where most practices sit, is where, you know, you need to get new patients in and you need to retain your existing patients, but you don't have to fill empty books. Most of you there? Okay. And then patient retention is for those lucky practices, and there was one in Melbourne on Monday who, you know, they've got patients, they're pretty good numbers, and they just need to retain those existing patients. Any of those lucky practices? So most of you are in sustained, and that's generally how it is. So your marketing budget, quite simply, if you are in rapid growth mode, does it follow logic that if you need to get patients in really quickly, then you need to spend more on marketing to get them in? So 7 to 10% of your annual gross income. Sustained is 4 to 7. Patient retention 2 to 3. See how it's much lower? Because you just need to keep your patients in. So those are rules of thumb. You know, you can go back, you can look at last year and you can say, okay, well, how much did we actually spend? And where did our growth look like? And was it actually on par? You know, were we actually retaining patients or, you know, bumping across the bottom? So it just means that next year when you're setting your budgets, you've actually got something to work on. And again, just go back, in the book, there's more of this. So everything I talk about, there's more in the book. Okay. Does anybody know Alvin Lowe from No Gaps Dental? Everybody, I'm assuming, has heard of No Gaps Dental. So Alvin, we worked with quite a few years ago, and I interviewed him for my book. You know, in my view, incredibly successful business. Would you agree? You know, and I was saying to Alvin, you know, what did you do? You know, what made you stand out? What made you different? And he said, well, when times were good, I invested. And I invested in the foundations, and I invested in building my brand, and I invested in, the basics for my business and my business brand and my marketing. And he said, and then when the hard times came and when the competition increased, he said, I already had those foundations in place. He said, and that's when the other practices woke up and went, crikey, I need to start doing something. But he was already off. Yeah, he'd already got the basics. He had the foundations, which meant that he could then grow while the other practices were trying to catch up. Does that make sense? So I guess my wish for you is, times are hard, okay, and I know that, but really think strategically and smartly about what you need to have in place, to cope with the market now. So, have a look. Just realised it's 2017, wrong slide. Have a look at your numbers, jot some down, see where you want to be for 2019. Go back to the practice as well, but also patient lifetime value, we've talked about. Outstanding treatment plans is another number that you may or may not be able to get out of your practice management software. Some practice management softwares is actually really quite easy to pull this number out. Some of them it's nightmare, okay? So see if you can pull that. And also patients with email addresses. Just see if you can track that number and see where you're at there, okay? So a couple of minutes, write down what you would like or what you think you would like your annual revenue to be, what you think your marketing budget should be, and where you'd like your active patients and new patients. Now, it's the next 2 pages. Okay, has the growth goals area there, and then the calculations of how you can work out the marketing budget from there. So again, what you can't fill in here, take back to the practice. You can also have a copy of this if you need a nice, fresh version. Okay, I'll give you a couple of minutes to do that. I'll talk a little bit more about email newsletters, but the reality is you guys know who your patients are, okay? If you were any other kind of business, if you were a restaurant or a shoe shop, you wouldn't know who your customers were. So as a dental practice, you actually can ask permission from your patients to see whether they actually want to receive marketing from you. So you can get their email addresses and you can start sending email communication. Okay, most other businesses can't do that. Okay, so you actually can, you've got the database, you've got their information, you can phone up your patients and you can say, we're going to start an email newsletter or we're going to do some promotions. Can I have your permission? So having this number as a metric to track is really important, because at some point you'll be able to say, right, we've got 10, 20, 50, 70% of our patients that actually want to hear from us, okay? And then, you're getting permission marketing. Instead of you having to try and get new patients and try to advertise to nameless facelesses, you've got permission from your patients. So it's a good metric to cover. And also it means that you can make sure that your front office is doing the job that they're meant to be doing as well and getting this information. So it's a good one to track both sides.